The Ministry of Health and Wellness is embarking on a series of reforms to improve the delivery of primary or community health care over the next few years. This is being supported by the tabling of the Primary Health Care Reform for Jamaica 2021 to 2030. Portfolio Minister Dr. Christopher Tufton tabled the document while delivering his contribution to the sectoral debate this week.
This will include an upgrading and networking for telehealth services of over 130 health centers, and that has started to include telemedicine and electronic record capabilities and the use of digital technology to support continued education and a review of the clinical guidelines, as well as enhanced diagnostics. There will be a rollout of a new chronic care model for management of NCDs that will provide more curative services to reduce the backlog in our hospitals.
Dr. Tufton says further major investment in infrastructure within healthcare is what his government is focusing on to be able to right-size public health to match some of the challenges being faced. Dr. Tufton says starting this year, the government will commit over $5 billion to support large infrastructure projects. He gave an update on Cornwall Regional Hospital.
Just an update on Cornwall Regional in preparation for your visit, but more so for the country. I'm pleased to report that we have completed Phase 1 and 2A at a cost of some $1.3 billion, and Phase 2B has commenced, expected to cost some 1.7 billion Jamaican dollars. And Phase 2B is aimed at remedial work or structural, to deal with structural defects that were present in the building. This will include the strengthening of structural beams that had begun to deteriorate and the rehabilitation of the other support systems to make the building sound. So remember, you go into the basement where we had to remove the chimney. That was the original design. And you will see when you go significant reinforcement work, steel work and other things happening. That's the Phase 2B, which we hope will be completed. It is on time, on schedule. The ministry has also received cabinet approval for the use of design and build for the implementation of the final phase, Phase 3. So that discussion is now taking place, and we will see that final phase leading to the restoration and reopening of the hospital.